10 Things You Did Not Know About Acne. 85% of young people suffer from acne, a disease in which there is chronic inflammation of the sebaceous glands, especially in the face, shoulders and back. Fighting it requires patience. The important thing is to get the recipe right, because it is not universal. Each case needs its own therapy, says Eduardo López Bran, head of dermatology at the San Carlos Clinical Hospital in Madrid. Along with other skin problems, such as psoriasis and alopecia, it has a very high impact on the lives of those affected. His persistence has fueled the myths that specialists have been fighting for years without much success. They assure that with an adequate follow-up, acne can be only a memory of adolescence from which there will be no scars, neither physical nor emotional. Disadvantages of the most effective medicine. Dermatologists speak of isotretinoin as a highly efficient product. In fact, its trademark, Roaccutane, is the most popular treatment against severe acne. This compound derived from vitamin A is also used against cancer, and thanks to it the comedones disappear from the face, the load of bacteria decreases and the sebaceous secretion ceases. But, like any drug, it can have adverse effects depending on the dose that is taken. Hence, specialists warn of the danger of self-medication. Most often, it produces dry skin, and symptoms such as tiredness, severe headaches and excessive sweating also appear. If a pregnant woman takes it, malformations in the fetus can occur. Say no to creams. Acne needs fresh air. That is why it is convenient to park the cosmetics, even those that are advertised as oil-free, sunscreens and makeup. Facing the disease successfully requires not touching the pimples and letting the skin breathe. The Spanish Academy of Dermatology and Venereology, AEDV, recommends cleaning the face twice a day to sweep away dead cells that can block pores, and dry without rubbing. And whether it is convenient or not to sunbathe is a controversial issue among dermatologists. They agree that, outside the hours of greatest radiation, the fat of the skin dries, but if it is intense it produces the opposite effect. A disease with 1,000 faces. All patients with acne have signs of acne on their faces, and 70% of them have them on their shoulders and backs. The most significant thing is that it manifests itself in many ways. Each one is indicative of the seriousness of the process, which is very useful for the doctor to orient the treatment. The plug that dead skin cells produce by clogging the pore can cause whiteheads, pimples in the dermis, the most benign form of the disorder. The next step are the typical pimples and papules, pink lumps that can hurt when touched. Then there are pustules, red pimples with pus and nodules, large, painful and solid internal joints. Finally, deep and pus-filled cysts appear. Pregnancy, a moment of regrowth. In adult women it is more common during pregnancy. The hormonal changes that occur in this period can cause its appearance or reactivate it. Menstruation and contraceptive use are also among the possible triggers. In this group, it also has a superior psychological impact. According to specialists, women confess in the consultation that acne influences their social, sexual and work relationships. Patience is as useful as therapy. The specialists approach this problem by 3 links, which have to do with the factors that facilitate the development of acne. The therapies regulate the sebaceous secretion, prevent obstruction of the follicle and decrease the number of bacteria. For mild and moderate cases, especially creams or gels with azelaic acid are used. In severe episodes, antibiotics are used. It is essential to start the treatment with the first signs, because the injuries can lead to scars that, if left untreated, leave a mark forever. And the key element, persevere in therapy, since acne takes at least 3 months to heal. Genetic, although not only hereditary. The predisposition to suffer acne we bring in our genes, but it does not always have to give the face. The most common is that a certain episode causes its appearance. Many times the changes that originate in the body during puberty already justify its debut. Can it be prevented? It is difficult, because acne is born in the middle dermis and has no external reflex until the pimples arise. What you can do is control it as soon as the first dots appear. The mature also suffer. Adolescence and acne go hand in hand. It usually develops between the ages of 13 and 15, and experts point out that in the majority of cases it would be cured without treatment around the age of 20. However, due to the psychological shock it produces, it requires urgent attention. Physicians have answers to anticipate the end of an illness that can become an ordeal. They also have them for adults, because 3% of men and 12% of women over 45 suffer from acne. Smoking worsens its evolution. Tobacco has no health benefit, and acne is no exception. It has been proven that addiction to nicotine makes it persist in people who suffer from it, among other things, because it produces inflammation in the tissues, one of the characteristic symptoms of this disease. In addition, it can act as a trigger among those who are predisposed to suffer it. The consequences also reach passive smokers, since smoke blocks the pores of the skin and prevents it from transpiring. Yes, you can have sex. Neither is a consequence of an increase in sexual activity nor is it related to the consumption of chocolate or nuts. Neither are we facing a contagious disease, nor is its origin always the lack of hygiene. Dermatologists insist on banishing these legends, although they point out that healthy habits, in food and in other activities, always benefit. In fact, it is advisable to avoid stress, take care of sleep and play sports. It is also recommended to have a careful hygiene and not forget that some soaps are harmful, because they have an inflammatory effect in the comedones typical of this ailment. It affects the mind more than the face. The specialists insist on the data of numerous studies that point out that 40% of the adolescents who suffer from it feel self-conscious and even 5% of those suffering from severe acne have thought about suicide. The disease and depression overlap, so often the help of a psychologist or a psychiatrist is needed, in addition to the dermatologist. The goal is to prevent the problem from becoming a chronic disease with repercussions on mental health, when it would have to be a passenger companion.